A warm welcome to all. Today, I am going to present a seminar on gastroesophageal reflux disease, commonly known as GER. It's one of the most common gastrointestinal disorder affecting people worldwide. GER is a chronic digestive disorder where stomach content flows back into the esophagus. This occurs due to dysfunction of the lower esophageal sphincter, leading to symptoms like heartburn and regurgitation. It is a common in modern lifestyle due to diet habit and stress. Gastroesophageal occur when stomach content flows back into the esophagus. It is also called acid reflux because the stomach's digestive juice contain acid. Sometimes people with GER can taste food or acidic that touches the lining of the esophagus, can cause heartburn. Also called indigestion, heartburn is an uncomfortable burning feeling in the mid-chest, behind the breastbone, or in the upper part of abdomen, the area between the chest and the hip. Occasional GER is common. People may be available of these tastes and heartburning sensation. People may be able to control GER by avoiding food and beverages that contribute to heartburn, such as chocolate, coffee, peppermint, greasy or spicy food, tomato product, and alcoholic beverages. Avoid overeating, quitting smoking, losing weight if they are overweight, not eating 2 to 3 hours before sleep, taking over the counter medication. Read more about over the counter medication in the section How the GER is treated. Initially, what is GER? GER is called gastroesophageal reflux disease. Is a more serious, chronic, or long-lasting form of GER. GER that occur more than twice a week for a week could be GER, which over time can lead to more serious health problems. People with suspected GER should see the healthcare providers. Then, what causes GER? Gastroesophageal reflux disease results when the lower esophageal sphincter, the muscle that controls as a valve between the esophagus and stomach, become weak or relaxed. Then it should not, causing stomach content to rise up in the esophagus. Abnormalities in the body, such as hiatal hernias, may also cause GERD. Hiatal hernias occur when the upper part of the stomach moves up in the chest. The stomach can slip through an opening found in the diaphragm. The diaphragm is the muscle wall that separates the stomach from the chest. Hiatal hernias may cause GERD because of stomach acid flowing back up through the opening. However, most produce no symptoms. Other factors that can contribute to GER including obesity, pregnancy, certain medications such as asthma medication, calcium channel blockers, and many antihistamines, painkillers, sedatives, antidepressant, smoking, inhaling secondhand smoke. People of all ages can develop GERD, some for unknown reasons. Then, what is gastroesophageal disease? Gastroesophageal disease is a reflux of acid from the stomach. Then, what is the gastrointestinal tract? It comes under the anatomy of esophagus and stomach. To understand GERD, we must first understand normal anatomy. The esophagus is a muscular tube that connects the throat to the stomach. At the junction, we have the lower esophageal sphincter, which acts like a valve. Normally, this sphincter prevents backflow of acid. The GI tract is a series of hollow organs joined in a long, twisting tube from the mouth to the anus. The movement of muscles in the GI tract, along with the release of hormones and enzymes, starts the digestion of food. The upper GI tract include the mouth, esophagus, stomach, small intestine, duodenum, which is the first part of the small intestine. Look at the picture of stomach. The stomach consists of upper part esophagus, then lower that esophagus we have lower esophagus sphincter, then last we have small intestine and it's the coverage of stomach. Then look at the anatomy of human. Initially start from mouth, esophagus, lower sphincter, stomach, small intestine, anus. Then, what are the symptoms of GERD? The main symptoms of GERD is frequent heartburn, though some adults with GERD do not have heartburn. Other common GERD symptoms include a dry chronic cough, wheezing, asthma, nausea, vomiting, a sore throat, harshness, swelling and irritation of voice box, difficulty swallowing or painful swallowing, pain in the chest or the upper part of the abdomen, dental erosion and bad breath. These are the common symptoms of GERD. Then, what are the diagnoses of GERD? Healthcare providers may refer people with suspected GERD to have a gastroenterologist, a doctor who specializes in digestive disease for diagnosis and treatment. Lifestyle changes and medications are often the first line of treatment for suspected GERD. If symptoms improve with these treatment methods, a GERD diagnosis often does not require testing. However, to confirm your diagnosis, people may need testing if symptoms do not improve. People with possible GERD who have trouble swallowing also may require testing. A completely accurate test for diagnosing GERD does not exist. However, several tests have helped with diagnosis. Upper GI series, while a gastroenterologist does not use an upper GI series to diagnose acid reflux or GERD, the test can provide. During the procedure, the person will stand or sit in front of a X-ray machine and drink barium. A chalky liquid barium coat the esophagus, stomach, and small intestine. So, the radiologist and gastroenterologist can see these organ shape more clearly on X-ray. The barium shows problems related to GERD such as hiatal hernia, while an upper GI series couldn't detect mild irritation. The test can detect esophageal strictures, narrowing of the esophagus that can result from GERD as well as ulcer or sores. A person may experience bloating and nausea for a short time after the test for several days afterward. Barium liquid in the GI tract causes white or light colored stools. A healthcare providers will give the person specific instructions about eating and drinking after the test. Upper endoscopy. A gastroenterologist may use an upper endoscopy, also known as an esophagogastroduodenoscopy, if a person continued to have GERD symptoms despite lifestyle change and treatment with medicament. An upper endoscopy is a common test used to evaluate the severity of GERD. This procedure involves using an endoscopy to small flexible tube with a light To see the upper GI tract, a gastroenterologist performs this test at a hospital or an outpatient center. The person may receive a liquid anesthetic that is gargled or sprayed on the back of the throat. If sedation is used, a special healthcare providers will place an IV needle in the person's vein. After the person receives sedation, the gastroenterologist carefully feed an endoscopy through the mouth and down the esophagus, then into the stomach and duodenum. A small camera mounted on the endoscope transmits a video image to monitor, allowing close examination of the intestinal lining. The gastroenterologist uses the endoscope to take a biopsy, a procedure that involves taking a small pieces of esophageal tissue. A pathologist, a doctor who specialized in diagnosis disease, will examine the tissue with the microscope and determine the extent of inflammation. A gastroenterologist diagnoses GERD when the test shows injury to the esophagus in a person who has moderate to severe GERD symptoms. Esophageal pH monitoring, the most accurate test to detect acid reflux. Esophageal pH monitoring measures the amount of liquid or acid in the esophagus. As the person goes about normal activities, including eating and sleeping, a gastroenterologist performs this test at a hospital or an outpatient center as a part of an upper endoscopy. The person can remain awake during the test. Sedation is not required for the test. However, it can be used if necessary. A gastroenterologist will pass a thin tube called as nasal gastric probe through the person's nose or mouth to the stomach. The gastroenterologist will then pull the tube back in the esophagus, where it will be tapped into the person's cheek and remain in the place for 24 hours. The end of the tube in the esophagus has a small probe to measure when and how much liquid or acid comes up in the esophagus. The other end of the tube, attached with a monitor outside the body, shows the test is more useful when combined with a carefully kept diary of when, what, and how much food the person eat and GERD symptoms that result. The gastroenterologist can see correlations between symptoms and certain foods or times of day. The procedure can also help shows whether reflex trigger respiratory symptoms. Esophageal manometry. Esophageal manometry measures muscle contraction in the esophagus. A small gastroenterologist may order this test when considering a person for anti-reflux surgery. The gastroenterologist perform this test during an office visit. A person may receive anesthetic spray on the inside of the nostrils or back of the throat. The gastroenterologist passes a soft, thin tube through the person's nose into the stomach. The person swallows as the gastrointestinal pull the tube slowly back in the esophagus. A computer measures and records the pressure of the muscle contraction in different part of the esophagus. The test can show if symptoms are due to weak sphincter muscle. Healthcare providers can also use the test to diagnose other disorder of the esophagus that might cause these. How then, finally, how the GERD can be treated? The number one, lifestyle changes. Some people can reduce GERD symptoms by losing weight if needed, wearing loose fitting cloth around the stomach area, as tight clothing can constrict the area and increases the reflex. Remaining upright for 3 hours after meal, raising the head of the bed 6 to 8 inches by securing wood blocks under the bedpost. Just using extra pillows will not help. Avoiding smoking and being around others who are smoking. Then some of the medications. Number one, antacid. Number two, H2 blockers. Number three, proton pump inhibitors. Number four, prokinetics. Then lastly, antibiotics. People can purchase many GERD medicament without a prescription. However, people with persistent symptoms should still see a healthcare providers. Number one, antacid, which include over-the-counter medicament such as Alka-Seltzer, Naxol, Mylanta, Rolaids, Riopan, or the first-line approach healthcare providers usually recommend to relieve heartburn and other mild GER diseases. Antacid, however, can have side effects including diarrhea and constipation. H2 blockers such as cimetidine, famotidine, nixatidine, and ranitidine decreases the acid production. These medications are available in both over-the-counter and prescription strength. H2 blockers provide short-term or on-demand reflex and are effective for many people with GER symptoms. They can also help heal the esophagus along, although not as well as proton pump inhibitors. Proton pump inhibitors include omeprazole, lansoprazole, lansoprazole, and esomeprazole, which are available as prescription. Omeprazole and lansoprazole also comes in over-the-counter strength. Proton pump inhibitors are more effective than H2 blockers and can relieve symptoms and heal the esophageal lining in the most people with GERD. Healthcare providers most commonly prescribe proton pump inhibitors for long-term management of GERD. However, studies shows people who take PPI long-term or high doses are most likely to have hip, wrist, and spinal fractures. People should take these medication on an empty stomach in order for stomach acid to activate them. Then prokinetics, which include methanol and metoclopramide, help make the stomach empty faster. However, both methanol and metoclopramide have side effects that often limit their use, including nausea, diarrhea, tiredness, depression, anxiety, and problem with physical movement. Prokinetic can interact with other medication, so people taking prokinetic agent should tell their healthcare providers about all medication they are taking. Antibiotics, including one called erythromycin, have been shown to improve gastric emptying. Erythromycin has fewer side effects than methanol and metoclopramide. However, like all antibiotic, it can cause diarrhea. All of these medications work in different ways. So, combination of medications may help control symptoms. People who get heartburn after eating many may take antacid and H2 blockers. The antacid neutralized stomach acid and H2 blockers stop acid production. By the time the antacid stop working, the H2 blockers have stopped acid production. Then surgery. When a person can't manage severe GER symptoms through medication or lifestyle modification, a healthcare providers may recommend surgery. A healthcare providers may also recommend surgery for GERD that result from a physical abnormalities. For GER symptoms that leads to severe respiratory problem, fundoplication is the standard surgical treatment for GERD and leads to long-term reflex control in most cases. A gastroenterologist or surgeon may also use endoscopic technique to treat GERD. However, the success rate of endoscopic technique are not completely known as researchers have not tested them enough in clinical trials. People are more likely to develop complications from surgery than from medication. Anti-reflux surgery is most successful in people younger than 50. Fundoplication is an operation to sew the top of the stomach around the esophagus to add pressure to the lower and esophagus and reduce reflux. A surgeon performs fundoplication using a laparoscope, a thin tube with a tiny video camera attached used to look inside the body. The surgeon performed the operation at a hospital or an outpatient center, and the person received general anesthesia. People can leave the hospital or outpatient center in 1 to 3 days and return to their daily activities 2 to 3 weeks. Endoscopic technique, such as endoscopic sieving and radio frequency, help control GERD in a small number of people. Endoscope sieving use small stitches to tighten the sphincter muscle. Radiofrequency creates heat lesion that help tighten the sphincter muscle. Surgery for both techniques required an endoscope. A surgeon performed the operation at a hospital or an outpatient center, and the person received anesthesia. Although the device for this procedure are approved, result may not be good as laparoscopic surgery, and these procedures are not commonly used. Then, what are the long-term complications of GERD? Untreated GERD can sometimes cause severe complications over time, including esophagitis, irritation of the esophagus from reflux stomach acid that damage the lining and cause bleeding or ulcer. Adults who have chronic esophagitis over many years are more likely to develop precancerous change in the esophagus. Strictures that leads to swallowing difficulty, respiratory problems such as trouble breathing. These are the overview of gastroesophageal disease. Then these are the points to be remembered. Gastroesophageal reflux, GERD, occur when the stomach content flow back into the esophagus. Gastroesophageal reflux disease is called acid reflux or acid regression because the stomach digestive juice contain acid. Gastroesophageal reflux disease is a common serious chronic form of GER. GERD results when the lower esophagus sphincter becomes weak or relaxed, when it should not, causing stomach content to rise up in the esophagus. The main symptoms of GERD is frequent heartburn, though some adults with GERD do not have heartburn. Other common GERD symptoms include asthma, a recurrent pneumonia, difficulty swallowing or painful swallowing, and pain in the chest. A healthcare providers may refer people with suspected GERD to a gastroenterologist for diagnosis and treatment. Treatment for GERD may involve one or more of the following. Depending on severity of symptoms, lifestyle changes, medication, or surgery. A healthcare providers should monitor a person with GERD to prevent or long-term complications. Thank you.